my name is NeDra, and I'm going through this situation, and it's probably been about a year that I've been going through this situation. I started having symptoms of being pregnant back in December of 2012. At that time, I thought maybe I was having some problems with my vaginal mesh, or I really didn't know what was going on until I seen my doctor. She made sure we got the ultrasound. During that ultrasound, I thought I had saw a fetus. Actually, me and my daughter was in the room, and that's what we did see. Since then, I've been pretty much going back and forth to doctors, emergency rooms, trying to get answers, but to no avail. I get no answers because I don't have a positive pregnancy test, which are either blood or urine. But as you can see, my stomach is very big and round, and I'm not just gaining weight, but because the weight is not evenly distributed as normal, as you would probably get fat. And I feel movement inside my abdomen, kicking, weight shifting from one side to the other. It's hard to get comfortable or lay on one side or the other. Most times I have to get to sleep on my back. I have limited mobility. Can't do any of the things I used to be able to do, like bending, just like driving my car is getting very discomforting and difficult. Working is pretty much, I basically had to stop working with the kind of work I do in home care. Pretty much I just been getting no answers. If I go to one place, they look at my EMR, because right now I'm labeled as in the medical community here as a hypochondriac and some disease called pseudomyostasis or something like that. It's supposed to be for I guess women that want to be pregnant so bad that they think they see these things and feel these things, like I say I'm experiencing. But with that disease, I didn't want to be pregnant. I had a permanent procedure done so that I would never have to be pregnant again, and which included taking a 1-inch the size of 1 inch out of my fallopian tubes and supposed to be cauterized. And since then, I have had a surgery with the vaginal mesh to repair it. And the only thing I can think of is the sperm and the egg was on a natural course and got fertilized right there with the mesh in the middle, and the baby got fertilized outside of the womb. So, like I said, I had saw it in the picture, and my daughter saw it. And most times with this pseudomyostasis, I guess there's only one person that usually witnesses this, but it's been two. So, but they keep telling me I'm crazy. But I mean, I could see if I wasn't experiencing all of these symptoms and going through so many problems, that I could see if maybe I wasn't this big. You know, maybe if my stomach was flat and, you know, I'm just running around saying, oh, I think I'm pregnant, or I got like maybe a small pooch and, you know, it never got any bigger than that. But this thing has been getting bigger and bigger month after month. So I'm not understanding why no one is really checking other than an endoscopy that they want to do, and which I did refuse it because I didn't want to be knocked out. And I know what I'm carrying, and I didn't want the baby to have the anesthetic. But they just think I just don't want to have it done. So anyway, I found out about the procedure. So hopefully in the next couple of days, I'll be getting that done so that I don't have to be knocked out. They don't have to use that kind of procedure as far as being knocked out. So I'll be getting that done in the next few days, hopefully. But other than that, I mean, that's the only thing they've come up with as far as determining what is wrong with me. They've done MRI scans, CT scans, but they say they show nothing. And I'll have an excerpt for you of the film that when you look at the film, you'll see that If I'm laying flat on my back, my stomach still protrudes if I'm flat on my back. So if that person that they said is this picture of me, it should have a protruding stomach on the skin line, on the skin plane of the film. But there's none of the pictures is protruding. None of the pictures has the vaginal mesh. That's supposed to be abdominal scans, and they tell me that you just can't see the mesh in there. But I refuse to believe that you can implant a medical device into my body and it never be able to be evaluated at a later time, or that you would be able to. You can't see it anymore, you know. So my belief is it's not my body on the film. So I don't know why they hide. I do believe that the baby is hooked to pretty much like maybe my abdominal aorta or something major. Maybe they don't want to deal with the situation. But the whole thing is that I believe that the baby is connected directly to my blood supply. And that's why they're not getting the increased HGH hormone, because it's like the baby is just like an extension of my body, and it's not giving those increased readings. That's the only thing I can think of there, because I feel the kicking, the moving, you know, and it's been going on for quite some time, and it's still going on now. And it's getting more and more uncomfortable. Like I said, recently I had to quit my job. So I just need somebody to help me. I need somebody to you know, look into this maybe. But I did find my answers biblically, and I can have something for you to read there as far as what the Lord says about this situation. So that's pretty much what I've had to hold on to is God, you know, in this whole situation. Because as you can probably realize, people think I'm pretty crazy by now, because this has been going on for almost a year. So most babies are born in 9 months. So, but I keep trying to tell everybody this isn't the same situation. But the other things that I've come across in getting different testing done, if they happen to do an ultrasound for something else like a kidney stone or looking at my pancreas, it seems like they won't put the camera where I would want them to put it, like in my back. If I feel something moving in my back, I'm like, could you put the camera back there? They won't do it. You know, it's like they just really don't want to find out. I don't know what's going on with the medical system here, but I'm just not getting any answers, and I'm just getting railroaded. So I need somebody to help me get to the bottom.